How are you, Wojciech? Nice to see you again.
And nice to see you. Nice to see you. Actually, today is quite nice because the sun shines and, well, everything seems to be okay apart from this COVID pandemic and war ongoing and such. Thank you. Thank you for asking.
That's a good attitude.
And how are things in Belgrade?
Pretty well. So far, no renewed outbreaks of the pandemic. Let's hope it stays that way.
Yeah, yeah.
Okay, hello to everyone once again. I think that we can start with our next session for today. And I'm glad that our colleague, Mr. Wojciech Vrba, is here with us. He's our colleague from University of West Bohemia in Pilsen, Faculty of Law. So please, Wojciech, you can start with your presentation.
Thank you, Mr. Stankovic. I will first try to share my screen, my presentation, so will have some pointers of what I'm talking about. It should be visible probably right now.
Yes, it is.
Okay, thank you. So my topic today is the occupational safety and health of Zbrojovka Brno workers during the Third Chezchoslovak Republic. This seems as quite an specific issue, but I assure you that my my presentation is quite general and focuses on one or two very general issues regarding legal history and law law itself. And the first, I would like to, I would like to talk about the legal history as a scientific field. We legal historians, we can go two ways by pursuing our our research. First, we can see a normative as it is by the eyes of contemporaries that were bound by this normative, by this norm. That is quite difficult. First of all, because there were and nowadays there are so many individual perspectives that we can take and look on the norm. That this way of pursuing the research really is quite complex and really is difficult. And the second one, which in my opinion is more well, not pleasant, but at least more simple in its core, is to have such anachronistic view on law that you pinpoint certain points, certain general points in your contemporary law, and then you try to apply those points, those frameworks on the law of the past. The typical thing that we as legal historians do nowadays in 21st century is that we think about human rights as something that we experience, and we try to find something as a human right in the past. And it is really complicated to find something as a human right in medieval Bohemia, because the society was such complex issue itself that something as a human right could not be really addressed by simply looking at it. We can, however, find something as a value of life some abstract value of life and look at the value of life of somebody who is being persecuted for murder during 1430s, who is persecuted for murder during 18th century, and who is persecuted for murder today. And these things really change, and they really can show you the flow of law, the change in law dogmatics of days. With this general introduction, I would like to address another problem, and that is that the lawyers try to compartmentalize things, and so we've come up with something called compartmentalization of law by issue. And one of these issues, one of these typical compartments, is so-called labor law, or law that regards work-related or employment, much better, relations between employer and employee related issues. And to have this complex compartment of law, we need to answer, generally speaking, 3 questions. And these questions have to be answered positively. So we have to answer yes for all these 3 questions. The first one if there is a social need of approval or a social demand for such regulation, such type of regulation as labor law, for example. The second one is there a specific object of such regulation? And the third one, is there a specific method of such regulation? And the first one really is a point that dances between legal theory and political consensus of the time. The second one addresses really theoretical issue, and as I will show you, the object of labor law, the so-called relations between employer and employee, were present pretty much in during the time of the Third Chezchoslovak Republic. And the third one addresses methods of regulation. There are usually 2 kinds of these methods of regulations. The first one is private law regulation. The second one is public law regulation. And the labor law itself is such a complex kind of law that it combines these two methods of regulation, but that does not mean that this new kind of regulation, which marries these 2 methods, should be ignored or should be nullified. That's theoretical introduction, and right now I would like to introduce you to the fundamental question I would like to answer at the end of my presentation. That question really is, did labor law exist during the period of the Third Czechoslovak Republic? To answer this question, we have to, answer these questions, and then the questions of what is the Third Czechoslovak Republic, and really what I would like to present this issue on the one key company established in Czechoslovakia before the Second World War, and that is the Arms Works Brno. Here I can show you the map of Czechoslovakia to present that the Arms Works Brno factory was really a nationwide phenomena, a nationwide phenomena. These not really good not really well executed circles are factories of Zbrojovka Brno, of Arms Works Brno. You can see that they were all over the well, at least Czech part of the republic. In Slovakia there were other daughter factories, related businesses that supplied Arms Works Brno with materials or, for example, ammunition, which is not really a material but a finalized product. But Zbrojovka sold it as a company, not the not the Bystrica factories. These are two products that Zbrojovka Brno is the most famous by in the world. This one is the Moser rifle, sold by the specification P18. In the interwar period, lots of these rifles ended in Romania, in Yugoslavia, well, and everywhere in the world. After the Second World War, we were selling these rifles to, well, Israel, to Iran, to Afghanistan, but also to Bolivia, to Paraguay, Argentina, etc., etc. And this one is the second famous, well, maybe the first famous product of Zbrojovka Brno. That's the light machine gun Bren, which is a cooperation between Zbrojovka Brno and Lee Enfield Arms Works in Britain. So the company itself was well established. Well, it was part of the war effort, because it was, well, nationalized, not nationalized, it was, well, it was led by the Nazi administration during the war, but the position of Czechoslovak Arms Works in Brno was really complicated during the war. I would not like to talk about it much more than it's really necessary. What will concern us is the position and the face of the company after the war. And it looked like this. It was a nationwide phenomenon, nationwide factory with many factories, a large administration, and a exporter of on a national scale, at least. Here you can see the logo, and here is the famous tower of Zbrojovka in Brno. And the second question of the presentation should be what, or the second helping question of the presentation should be, what was the Third Republic? And the Third Chezchoslovak Republic is the short but very volatile time between the liberation of Czechoslovakia and the communist coup d'etat, or, well, the communist coming to power, because that was not executed during those 7 days, 9 days, between 17th and 25th of February in 1948, but rather it took, well, at least a few years. The main activity of Communist Party began, well, rather right after the war, and the final words of well, communists coming into power could be traced, well, somewhere between summer of 48 and summer of 49. This short period of time was really typical by one thing, that led all the nation of Czechoslovakia forward, and that was, well, a notion of rebuilding. rebuilding a republic, rebuilding individual businesses, rebuilding, well, cities that were bombed at the end of the war. And this was really a fine capital for most of the political parties back there. The one party that really could use the most of it, and that really used the most of it, and finally came to power as a totalitarian party, was the Communist Party of Czechoslovakia. But what has to be emphasized is that the work of rebuilding something, this notion of rebuilding, was typical for not only political programs, but also for the everyday life of everybody. You could go to the factories, cafeteria, and there were flyers and giant transparents that were saying we are rebuilding the republic, and that was far before the communists coming to power. And then you can probably see somewhere those fine flyers of communist propaganda. But this was before those times. Here you can see the key figures of those times. The chairman and later president of Czechoslovak Republic, Klement Gottwald, chairman of Communist Party, and here the president, Edvard Beneš, well, the president of Czechoslovakia back then, until his death in 1948. What I was looking for during my research in Zbrojovka Brno, I was generally the exporting licenses for arms and ammunition after the war. As it is, as usual with archival research, you usually find something else than you are looking for. So I found out this thing which is written in Czech, but I would like to show you just just how it looks. This is a summary of occupational health and safety regulations in Zbrojovka Brno. And well, there is this notion of labor law during the First Republic and the Third Republic as being something of a vague notion, of non-really existing notion, existing phenomena within the civil law or the private law mostly. And here I found this, which well, led me to quite contrary, to an opinion that is quite contrary to this this paradigm. I would like to show you just two main regulations applied that are mentioned here in this summary. And you will see that the labor law, in fact, or the regulation of labor, was really an issue that was addressed well, and in my opinion, quite better than today. Just generally speaking, there were two levels of regulation. The first one were the general provisions applicable on every issue within something any issue related to labor. These general provisions could be found in two crucial acts. The first one was the General Civil Code, and the second one was the General Criminal Code. And then there were special provisions. There was a regulation specific for each field of specific sector of economy, and these were, well, there were lots of them. But for example, Trade Licensing Act had some labor law regulations in it. Mining Act or Act on the Work of Private Employees of 1934 had some of them. Now, those first two, and I will not bother you with those special provisions. I will just shortly show you the scope of that paper that I found. As for the general provisions, the first one should and could be found in General Civil Code of 1811. Here you can see this wall of text. I don't want you to read it all, but I've highlighted some of the issues, some of the hallmarks of the regulations. You can see that the paragraph 1157 was dealing really with health and safety occupation of employee, and it really said that an employer has a duty towards the employee to provide him with particular care, and this care was not a care of some basic level. It was a level of care that should be that should be provided in accordance with the needs of the employee regarding the work itself. Employer should provide employee with tools, with workplace, and it all had one crucial regulator, and that was or regulator, or maybe principle of regulation, and that was the work, the core of the work itself, the means of the work itself. The second paragraph of the in Czech Republic we divide it into paragraphs, and then those paragraphs have their paragraphs. So I should probably say better the second section of the paragraph 1157 demonstrated that there is a difference between employee who works at some kind of workplace, e.g. factory, and then there were employees which worked in the employer's home, at employer's home. And these employees should have been taken off much more carefully than those at factories or at the place of work. They should have been provided with workplace, place for rest and sleep, with a proper nourishment, and also the employer should have overseen that the hours of work and rest had been arranged according to, and this is really interesting, employees' health, decency, and religion. Nowadays, it's all about, well, health. Back there, it was about health, decency, and religion. At least in the act, I'm not talking about the the real thing, because that was quite different. Yeah. On the paragraph 1157 was answering the paragraph 1164, which stated that those rights, those fundamental rights in 1157, could not be abridged or nullified by the employment contract. That is really important to have such a clause in any legal framework regarding labor law. The second article that was regarding that was dealing with the issue of labor law in its general provisions was the Article 335 of Criminal Code of 1859. This clause, this paragraph is really, really complicated to interpret, but to sum it up, if you were an employer and an injury was, or battery was dealt to an employee, you could be held responsible not only in private law, by private law means. You could not be only eligible for damage compensation to the employee, or better, the employee wouldn't be only eligible for compensation from you as the employer, but also you as an employer could be criminally or administratively prosecuted. You could end up in imprisonment from 1 to 6 months, or even from 6 months to 1 year. That was judged by the consequence of the misconduct, and the consequence could be any kind of damage or injury or battery, or unfortunately even death. If death occurred, then you could be imprisoned for 1 to 6 years. And what is interesting from a legal point of view is that this article of Criminal Code was written as not really something that could be interpreted only as a typical criminal code regulation. Yeah, I will be ending shortly. But also an analogy could be applied on any injury that was sustained during the employment, during the working hours probably, but during the employment of the employee. And this injury could be then, or the action that led to the injury, or the act of omission that led to the injury, could then be prosecuted according to the paragraph 431 of the Criminal Code. That paragraph 431 really says that it should be prosecuted by the paragraph 335. Yeah. So I would like not to bother you with those special provisions, but I would like to show you one thing, and that's that paper I found. Right now, I don't know if I'm sharing probably my presentation. Yeah. So I will just try to end the share of the presentation, and here you can see the paper I found, and here there are those common regulations that I was talking about right now. And here you can see all those regulations that applied on the workers of factory of Armsworks Brno. These are many regulations of government, regulations of regulations of government. There are many specific acts that regulated the presence of or the labor of those workers. For example, acts about explosives were also relevant. So to end my presentation, really, I would like to end this and to return well, no, not here. To return here. That is here. Yeah. To end the presentation, was there a social need of approval or social demand of such regulation as a regulation of labor? Definitely yes, because there was a need of specifying what labor is, because everyone was doing some kind of labor, because it was called for, not because the official political situation or political argumentation, but because it really has to be done. Those bombed cities had to be rebuilt. The country had to be rebuilt. Everyone knew that. Was there a specific object of such regulation? Well, yes, and the regulation, the legislator knew that, and he knew that long before the Second World War. He even knew it long before the First World War. And was there a specific method of such regulation? Well, definitely yes, because the method even then combined the public and private law methods of regulation. In fact, those regulations, those articles in the civil code, which is in its nature of private law, were sort of public law incorporated in that private law code, that private law act, which is really extraordinary. So, last sentence of my presentation, and I'm really sorry I had it a bit longer than I thought I would have it. Then I would thought that it had be the labor law really existed. Yes, there was a labor law, and that is really a fact. That's all from me. Thank you for your attention. Thank you for invitation to Iustoria. I'm really happy that I could present my work here.
Thank you, Wojciech. Thank you, Wojciech. I always feel a little bit uncomfortable when I have to remind our participants on duration of their presentations, but having in mind that we are already late with this session and that we have another one today, I just have to be sometimes a little bit cruel. So we have another topic in this session. That is our colleague, Aleksei Kapustin. He's coming from HEO University associated with IA EAEC Faculty of Law. So I hope that Aleksei will finish in approximately 15 minutes, and then we will conclude this session with another discussion. Aleksei, please.
Hello. Firstly, let me say thank you for this opportunity to speak in this conference. So, the topic of my presentation is the history of healthcare standardization in Russia, law and medicine. The history of the development of standardization dates back more than a century. Elements of standardization can also be found in Russia during the Zemstvo period from 1864 to 1970, when the Medical Council of the Ministry of Internal Affairs of the Russian Empire issued instructions for doctors, which can be considered as a kind of approach to the standardization of medical care. The process of standardization in the healthcare of the USSR begins with the establishment in 1925 of the Standardization Committee under the Council of Labor and Defense of the Council of People's Commissars. The orders of the Ministry of Health of USSR approved the provisions on the organization of the work of healthcare institutions, services, as well as one of the provision of medical care. The Ministry of Health of the USR and the Republican ministers also approved methodological recommendations for the individual diseases which were developed based on the analyze of best practices or errors in the treatment of specific patients of groups of patients by special expert councils leading scientific institutions. Such recommendations counted a description of the clinical picture diagnosis recommendations for treatment and prevention. They can be called a prototype of clinical recommendations in the modern sense. The next stage in the development of standardization was the transition period of the Russian economy in the 19th of the 20th century and the publication of the law of the Russian Federation on standardization. From 1991 to 2007, there was a norm on accreditation of medical institutions by determining their compliance with established professional standards introduced by the law of the RSFSR on medical insurance of citizens in the RSFSR. The order of the Ministry of Health of the Russian Federation on leasing and accreditation of medical institutions regulated the procedure for the establishment of leasing and accreditation commissions under the territorial health management bodies. The Central Republican Commission for the Leasings and Accreditation of the Ministry of Health of the Russian Federation and the Commission for Leasings and Accreditation of Medical and Preventive Institutions of Republican standardization were established. In accordance with the order of the Ministry of Health of the Russian Federation and the compulsory medical insurance on improving the quality control of medical care to the population of the Russian Federation, leasings and accreditation commissions were determined by the subjects of non-departmental quality control of medical care. These commissions have been established in all subjects of the Russian Federation. The Ministry of Health of Russia issued regulations regulated the accreditation of structural units of medical and preventive institution. Decree of the President of the Russian Federation on measures for the development of healthcare in the Russian Federation gave new impetus to the development of the process of standardization of medical care. The Ministry of Health of the Russian Federation was instructed to develop a set of standardization for the provision of medical care per citizen of the Russian Federation, ensuring a guaranteed volume of medical care and sanitary and epidemiological welfare of the population, as well as unified state standards for the quality of medical care and pricing methods for the provision of medical services to the population. Pursuant to this decree by order of the Ministry of Health of the Russian Federation on the creation of a system of medical standards for the provision of medical care to the population of the Russian Federation, approved a temporary regulation on medical standards in the medical insurance system, which classifies medical standards depending on the administrative territorial division and the professional principle. International standards are also highlighted. In order to develop and coordinate the application of medical standards and appropriate determined department for medical and economic standards was created at the Ministry of Health of the Russian Federation. In order to ensure conceptual unity and coordination of work on the creation of regulated documents on standardization in the healthcare, harmonization with the international standardization system, the Collegium of the Ministry of Health of the Russian Federation, the State Community for Standardization, Metrology and certification of the Russian Federation, and the Board of Executive Directors of the Territorial Mandatory Medical Insurance Funds adopt a joint decision on the basic provisions of standardizations in healthcare. Also in 1998, the work program for the creation and development of a standardization system in healthcare was approved along with the Ministry of Health of the Russian Federation, the Federal Compulsory Medical Insurance Fund, the State Community of Standardization, Metrology and Certification. It became the basic of the standardization system during this period. By 2002, a lot of work had been done to create the developed standardization system. However, the federal law on technical regulation abolished industry and administrative territorial standards, protocols for the management of patients. Now, national standards and organizations standards could be adopted. The application of standards became voluntary. Mandatory requirements for products, process and services could be established only by technical regulation. Federal law 2004 and 2005 delimited the powers of standardization in healthcare between the levels of government. The federal level has the authority to establish standards of medical care and monitor their compliance. Thus, it was possible to establish federal standards of medical care as minimum and regional standards of medical care, which had to comply with federal or be higher. In order to develop standardization in healthcare, federal law on amendments to certain legislative acts of Russian Federation in connection with the improvement of the division of powers was issued. Paragraph 1 and 3 of Article 6 amended Article 5 of the Fundamentals power of federal public authorities in the field of public health protection, giving from January 1st, 2008, the Ministry of Health and Social Development of Russia the authority to establish standards of medical care, standards of for equipping the healthcare organizations with medical equipment and other federal standards in the field of healthcare. Also, paragraph 8 of Article 6 of this law from 1st June 2007 of the Section 8 of the Fundamentals was supplemented with the article Types of Medical Care, under which the procedures for proving primary health care, emergency medical care, and specialized, including high-tech medical care, are established by the federal executive body responsible for developing state policy and regulation in the field of healthcare. After securing in June 2008 the authority to approve the procedure for the provision of specialized medical care for the procedure for the provision of specialized medical care, which was completed in April 2010. Since 1st June 2012, after the entry into force of Article 13 of federal law on the basis of protecting the health of citizens in the Russian Federation, registration of medical technologies has been suspended. The authority of federal public authorities in the field of healthcare to issue permits for the use of new medical technologies has been excluded, as well as the requirement to use in healthcare practical only methods of prevention, treatment, medical technologies, authorities for use in accordance with the established procedure. Thus, since 1st June 2012, the function of issuing permits for the use of new medical technologies has been completely discontinued, and it is not required to obtain a permit for the use of new medical technologies. In 2012, a new concept for the development of the national standardization system in Russian Federation for the period up to 2020 was adopted, within the framework of which the national standardization system includes a set of general technical standards and standards for economic sectors. Occupational safety and health standards, safety standards in emergency situations, and other standardization subsystems, as well as participants in standardization work, included standardization of defense products and documents on standardization of such products. A new stage in the development of the standardization system in healthcare associated with the adopted federal law on the fundamentals of public health protection in the Russian Federal, which basically came into force on 1st June 2012. Part 5 of Article 32 of this law established the obligation of the authorities, federal body, to establish regulations on the organization of medical care by types, conditions, and forms of such assistance. At the same time, in 2012, the regulation on the organization of primary health care for adults was approved, and only at the end of 2013, the regulation of the organization of specialized, including high-tech medical care, was approved. Prior to that, there was an order on the organization of specialized assistance in the 2010 edition. The fundamental difference of the new provision is the establishment of rules for the organization of not only specialized but also high-tech medical care. The innovation of federal law 2030 is the additional inclusions in Article 64 of clinical recommendations as the basic for the formation of criteria for the quality of medical care. Standardization of healthcare is a long painful process, but necessary. Planning and financial distribution can only take place of the basic of stable base standards. However, we need to be careful when using medical standards in the treatment of a patient because economic planning of the expenditure of funds for medical procedures that a person usually needs for this disease is one thing, and a personalized approach to the treatment of a particular patient with his personal history is quite another. That's all. Thank you for your attention.
Thank you very much, Alexei. And now let me open the discussion about two previous presentations. If anyone has any comments, suggestions. Nina is raising a hand. Nina, please.
Thank you. I just have a brief question for Wojciech. What was it like in the period in Czechoslovakia when it comes to employee insurance? Was there any? Was it mandatory? How did it go? Because it's a slightly different period, but I remember in the interwar period in Yugoslavia, there were various problems with mandatory employee insurance that was introduced by law, but that employers weren't so happy about.
Yeah, thank you. Thank you for the question. As far as I know, during the First Republic, so during the interwar period, there were certain mandatory employment insurances. Employers were mandated to insure their employees, but these mandates, these mandatory insurances, were only in certain professions. Namely, I think it was for miners, people who are mining, for certain low income workers and the factory workers. These insurances, these regulations of insurance really their source was established even before the First World War. I think that the mandatory insurance for factory workers was introduced sometimes between 1880 and 1900s, but I'm really not sure regarding this issue. But yeah, there were mandatory regulations, mandatory insurances of certain employees in certain sectors, certain fashions. Yeah. As far as for the practice of insuring, I'm really not. I'm really not sure. I really don't know. I know that there was a hierarchy of so-called insurance courts. Yeah, that's probably the translation. That was a special court that dealt with problems of insurance, and then there were so-called workers' courts, and the workers' courts were established to deal with issues of relations between employer and employee. But as far as I know, the issues of insurance, of mandatory insurance of employees by employer, were in the agenda of the so-called insurance courts, as far as I know. Well, yeah, that's all.
Thank you, thank you. It combines well.
Okay, any other questions, remarks? Okay, if not, thank you all for participating in this, but not only in this session. I'm concluding our 5th or 6th session, I'm not sure more. There were a lot of interesting presentations these days, and proclaiming a break in duration of how many minutes, Nina?
Well, let's say 10 minutes. We're a bit behind schedule, but we do need to grab a cup of tea, coffee, or whatever people might need. And this was the last English session for today, so sorry, international audience, the next session is in Serbian, but tomorrow we again have a keynote lecture in English at 10, and then another English session with 3 more very interesting papers.
Okay, thank you all. See you in 10 minutes. Bye.
Thank you.